lots of new considerations with COVID and things you guys need to be aware of and think about in preparation. That's why we're kind of, amping up what we do as far as meetings with groups. Certainly it is an evolving situation. So, we're going to do our best to keep you guys aware as we move through the semester of anything that might come up. Right now, the numbers are looking really positive, and countries are starting to sort of move away from any restrictions, entry and exit restrictions. So, it's looking good in that way, but we all know, we can look at the past 2 years and see what has happened to know that it can continue to change. And it may change in country too. So, we will obviously be in contact throughout the duration of your program to let you know if anything changes. So maybe we'll just go ahead, maybe we'll introduce ourselves, because I think not everybody knows. I think students know each other, but so I'm the Global Education Specialist out of the Office of International Affairs. I'm not traveling with the group, but I kind of work between the College of Nursing and the faculties to help, prepare students and work on in-country arrangements. I can answer questions about programming and kind of do my best to get you guys ready to go. And then I might, Jeannie and Tracy, if you guys want to introduce yourselves, and then we'll go for the students.
Yeah, and so I think you guys have met me before. I'm Jeanne Bohn, and this will be my second time going to Norway with the group of students. So very excited about that. And yeah, and so we'll be with you all along the way, figuring everything out together. But I have been there once before, and we've worked with our Norwegian partners. Actually, even though we haven't gone to Norway the last couple of years, I actually meet with them every week pretty much. And so that's a really strong collaboration. We have several international presentations that I think we just presented 6 different international presentations at Sigma Theta Tau back in, I guess I forget when that was, like in September or November or something like that. We've got a couple manuscripts as well. So pretty involved. So they're great people to work with. So
I'm Tracy Taylor, and I've worked with Jeannie a lot over the last couple of years. And I teach community in the RN to BSN program, but I've also taught community in undergrad classes too. And so I'm very familiar with being out in the community and, working with different populations. And I used to do home visit nursing too. And a lot of stuff with teen moms and then postpartum moms out in the community. So I'm kind of used to being out there, and then kind of the same background as Jeannie, school nursing and pediatric screenings and setting all that up and arranging and all that. I've done all of that too. So I'm super excited. It'll be my first time to get to go, because they keep telling me no every year, right? Because of COVID, but
not you, it's us.
Yes. So I'm really excited to go and be able to finally experience, all of the community stuff that I've always done over the years. I haven't done it in a different culture. So I'm very excited about that and excited to go through that with you guys.
And students, maybe if you could just tell a little bit about yourself and what your interests are, and maybe, what kind of drew you to apply for this program. So Jeannie, maybe first.
Sure. I'm Jeannie Sherman. I'm happy to meet another Jeannie. It's very rare.
Felt the same way.
Yeah. I actually don't know if I've ever met another Jeannie. I've met Jeans.
Okay. It's actually Janine, but I do go by Jeannie.
Okay, cool.
We have another one in our office too. So it's very
you're right.
Yeah.
Oh, cool.
Jeannie, but with 2 N's. So
okay.
Awesome. Well, nice to meet everyone. I'm in the graduate entry program, obviously. I'm on the nurse midwifery track, and I'm super excited about going to Norway. Sorry, I was telling Jenny before, I have Crest white strips on right now, so I'm talking a little weird. I'm super excited to go to Norway. because I'm really interested in working abroad, like long term. I would love to work for the WHO and like deliver babies in countries abroad and do public health education and things like that. So I really wanted to get the chance to have an international nursing experience. And I know that we're going to be doing community health, which I think is really cool because I'm really excited to do that in a foreign setting. And I also know that Norway has an amazing like healthcare system set up with midwifery and with birth. And so I know we're not going to be doing that specifically, but I just thought it would be really cool to like be there and ask questions and see how that works too.
Well, I think actually the great thing about having a smaller number of students is, we're still in the very planning stages because we were kind of waiting to see, what was going on and student wise and everything as well. But, if we know some interest, there possibly could be that we could kind of make a request. I know in the past or previously the one time we did have someone who came and talked to our group about lactation and so and services provided in Norway. So hopefully we can try to, maybe this will let us kind of like individualize things a little bit more. No promises, but maybe.
Right.
So.
Awesome.
All right, Ashley.
Hi, I'm Ashley. My track is adult gerontology. And I was drawn to this program because, like Jeannie, just having the opportunity to like practice what you practice in your field in another country when you probably won't be able to do that after graduation unless you move to that country. So I think that's really interesting. Two things that really grabbed me were you could get all of your community health hours done, which was really cool because I work full time. So like eliminating one of those days for me coming back is really helpful. And then also just knowing that the nursing students get to have clinicals in patient homes, like they'll do rounding that way, because I'm really interested in home health. And I think that's one of the barriers that older people have is like they can't get to their doctor's appointments, whether it's for well checks or illness. So it'd be interesting to see that and how that how Norway does it.
Yeah, and do you know what? Like, just even I mean, I'm not an older adult. I don't consider myself, but what about putting on TED hose? That, something as simple as that, and a nursing intervention, putting on TED hose, that can really be a game changer, when you're going into someone's home, just literally to do that. That is a huge thing for prevention. So.
And Priya?
Hi, my name is Priya, and I am on the pediatric specialty, so I'm super excited. What really drew me to the program, so I just graduated from undergrad last May, so just a little less than a year ago, and I was planning to go study abroad in Peru for my Spanish credit, and then that program got canceled. So then I was going to go to Spain, and then that got canceled because of COVID. So when this program came up, I was stoked, and I was like just so excited. I told my parents, and they're like, "Oh my gosh, absolutely!" Like I'm just really excited. And growing up, we traveled a lot, and it was so much fun. And I think that every time we'd come back, we would just like debrief with my family, especially like my mom, and just like see what was different and what was the same and how we could connect and all this stuff. And it was just so special to me. And I used that a lot in college through one of the programs I was in, and I absolutely loved it. So I just really love getting to know different cultures and how people live their lives, and just get to see like just that diversity and be able to bring bits and pieces of it with you and get to practice that in your own life, and just realize like, oh, it's very unique and special because I pulled it from this place I've been, and it just makes me feel like a fuller person that can relate to more people. So I'm super excited for this program, and just being able to take like what we're learning in school, and honestly kind of like what Ashley said, like being able to practice in a country that we don't live in, because I feel like that's not a common thing that you just like go off and be like, oh, by the way, I worked in Norway, like very random, but very cool. So I'm just excited for everything that we get to like learn and see and do and just like grow and like engage in that culture for such like those 2 weeks and just see what happens. So
yeah, well, I am very excited for all of you as well. And, it has been several years since we've sent students abroad, so it's good to finally be seeing faces again that have got, approved programs and applications. And so today, most of what we're going to be talking about is really, kind of preparation, very early preparation stage for the program, things to kind of be thinking about, things that you can be doing now to get ready. And then most likely the second time we meet will be the program in May, or the date in May that your group will be getting together. That date and time will be, I don't know if you guys have that information or if you're still pulling it together.
Yeah, the day in May. So you guys, all of your clinical hours will be completed. You do have some lab hours though, that you will have in community. So and that's like your clinical orientation day, and then there's some like a skills, and then at the very end you'll have your simulation as well. So but everything, and what we'll do is we'll do that on a Wednesday. All right. But so what we thought we would do to make it easier, so you only have to come to campus, at the beginning, the one time for lab, is we were going to have that be on Wednesday, May 11th. I think that's Monday, May 11th. And it's a Wednesday. And you'll come on that day. And then you just need to plan to be there all day. And the reason why is because we'll do the 5798 class that you guys have to take as well, that 0.5 credit. We'll do that. And Jenny, that's when you'll come. If we can figure out between, the three of us, like what time works best for you, Jenny. But we'll do, we'll do the clinical lab orientation part of the day. And then the other part of the day will be that part of the class, that 5798. So just plan on being all day. We've got a little flexibility in when we do what. So if that makes sense, Jenny.
Yeah.
Okay.
And you guys are far more busy than I am. So just, I think whatever works best for you guys and the students is I can get on my calendar.
Okay.
Yeah, so I will have sort of some further information for you on that day, as will Jeannie and Tracy. And, most of my information is kind of logistics, registration, administration stuff. And they will kind of talk more about, the in-country things and the academic side of things. So let me just see if I can get this to work. So today we're going to talk about the online portal and things that you should be looking at in there, academics and registration, fee payment and cancellation, COVID related costs and considerations, other health considerations, and then COVID-19 planning and preparation. Again, I will preface this by saying, especially with the COVID stuff, all of it is true as of today. So as we hear updates with, entry requirements and other COVID related requirements in country, we will get them to you. But right now it looks like, Norway are kind of drawing down on some of their restrictions, which I will talk about. So with the profile, the portal that you guys created when you submitted your applications, there are other things that you'll need to go in there and do. I haven't checked recently. I know that you guys all sort of submitted your everything that you needed to do for acceptance into the program, and within that first 10 days. The next kind of phase are things like there's some health and safety videos that you'll need to watch, and then some other documents that you'll need to fill out. All of that is important. I think everybody submitted their passport as well, which is good. So I'll, be booking the flights in the next week or so. But there's things like, health and, sort of dietary requirements and any other requirements that you might have to support your academic learning while abroad. So making sure that you're being thorough in all that information. If there is anything that you think is really going to impact your experience that we need to start making arrangements for now, I encourage you guys to reach out to one of the three of us to kind of begin discussing what that's going to look like for you. Some things like dietary requirements are easy. Some other things require a little more lead time to make sure that we can kind of support you and your experience. So as far as academics and registration goes, so you would all, have you guys been registered for that course yet, or have you all have? So just making sure that, you're in that 0.5 hours of 5798S for summer 2022, and that you're in the appropriate section for the nursing 6240, and that, you don't sort of take yourself out of those courses for any reason. Obviously they will be graded OSU credit, just like they are, if you were here on campus. And the 5798, will be taken care of with that preparation course on May 11th. So that's when those hours will be earned. Program fee payment. So the program fee initially was like 46 something. With the $900 subsidy, it's come down to $37.24. That will be added to your statement of fees and accounts for summer 2022. You'll need to pay it by the same date that you'll make your payments for your tuition. So it'll all kind of be wrapped into that. That program fee includes your international airfare, some of your meals, accommodation, program-related field trips, and a public transportation pass. There are quite a few meals that aren't included, so kind of budgeting for those. I was also reading that with your with the hotel stay, you do get a discounted breakfast at the cafe around the corner. I think, in past years we included breakfast, but because students were kind of starting the day at all different times, some were getting it and some weren't. So it really, it didn't work out to have everybody pay up front for it. So there's also a kitchenette in your room. So you'll be able to kind of, if you want a sandwich or, kind of keep stash some food back there, you can kind of do that as well. So personal expenses are not included. So, if you go out in the evening or if you need new luggage, anything like that. If you're a US passport holder, you do not need a visa. So I don't think that anybody in this group will need to apply for a visa. The MRSA test and treatment, Jeannie, do you want to talk about that?
Yeah, so as it gets closer, and I need to double check with UNI, but UNI is actually our international partner over in Norway. So I believe last time the students had to get tested like for MRSA, I believe it was like 1 month out, because if you came back positive, you would need to get treated and everything with antibiotics. So that is a definite requirement. They also have COVID vaccination to be fully vaccinated as well. That is a requirement for this clinical site. And then in terms of, I think all of your other vaccinations will be fine. I mean, I think you'll be fully, fine with what we require. But as always, we just have to, if something comes up and they need something, then we'll have to abide by what they tell us. So, but I think you should be fine. So it's the COVID vaccination, but then also getting MRSA tested. And we can provide you more guidance on that. Last time we had students get tested over at the Student Health Services. So we just need to let them know like how many students are coming. And then do you guys have a class that all meets at the same time? I know you guys are in peds and OB right now.
Actually, the three of us are all in the same rotation. So our class now, like starting this week, will be Friday from 1 to 4:30. I don't know about the other three people in the program, but I know for sure the three of us are all in the same one.
Oh, well, that's good. So maybe we'll try to see if we can get 2 days scheduled. there's not as many of you this time, so it's probably not as big of a deal, but anyhow, so we'll let you know a little bit about that once we get that arranged for you.
Yeah, and then, I always tell students that flexibility is really key to an abroad experience. We kind of provide you with the information, especially, we found out as it relates to COVID that things are just constantly changing. So, 1 week we tell you one thing and then it changes, and then we have to, kind of reverse or, change direction. So it's not because we don't know what we're doing. It's, the goal has been moved back and forth for us quite a bit over the last couple of years. So flexibility is key. And when you get in country too, things happen, things change. So kind of being able to roll with the punches. I'm assuming, you guys are all in the field you're in because to some degree you can do that really well. So just kind of keeping that in mind when you're planning your experience and thinking about what your experience is going to look like. Tuition is also not included in that program fee. The only additional tuition you should have is that half credit hour. There shouldn't be any other tuition associated with the program. And then post-program quarantine expenses. So currently the United States makes you take a COVID test, provide a negative COVID test to return to the US. Should you test positive while you're over there and have to quarantine prior to returning, then those expenses would be have to be funded by the students. Obviously, one of the faculty will stay and there'll be support on the ground for you while you're there, and they'll help you make the arrangements. But that's one thing that you kind of need to be aware of. Potentially, that requirement to test when you come back to the United States might be gone by the time you guys travel too. So there's always that. I will click on the cost sheet here if I can. Oh, it's not letting me. So on each program brochure page, and I'll put this, I'll put these links and this PowerPoint in the on your portal too, so you can go back and look at it. On the program brochure page, there is a link to a cost sheet. So essentially, it will lay out all the billable and non-billable expenses that you can kind of, so you can kind of plan your budget a little bit. The billable expenses are at the top there, the non-negotiables, what, the program fee, your tuition. And then the non-billables are what's, might be extra. You may or may not incur these. It's things like your passport. We include a budget for meals. You may or may not, expend that much. And then that cost sheet is really, if you need to speak to financial aid about adjusting your loan package or an increased cost of attendance, that's the sheet that you'll take with you to financial aid to discuss that. And then when to pay. This program fee is due at the same time as your tuition. I think I mentioned that. And typically that's in early May. Again, this is kind of the information about financial aid. If you need to meet with anybody to talk about the increased cost of attendance, you'll take that cost sheet with you. And that's what you can use to kind of discuss that. So a timeline. So financial aid distribution is 10 days prior to the start of Ohio State term. The program start date is 5/20 is when the flight will depart, and then 5/21 you'll arrive. There's currently no quarantine requirements in within the for Norway, so that's not something that you'll need to worry about. And then the program end dates 6/4/2022 is when you'll fly back to the US. You will need to be COVID tested prior to returning. That is included in your program fee, so you will organize as a group to get COVID tested to return to the US. Hopefully that will change. I've got my fingers crossed because I've got some international travel too planned. So COVID test before return is included in your program fee. Your flight insurance. So you guys, your flight is included in your program fee, so you don't need to worry about insurance. I'll talk in a minute about cancellation and what possible scenarios are. And then your quarantine costs, that varies as well. So if you need a more specific quote, you know, we can kind of probably get one from Uni. But I do know that, you know, they are supportive and will help students to sort of find appropriate accommodation should they need to stay there. Student withdrawal policy. So we kind of have rolling withdrawal policy that kind of increases as we get closer to departure date. So, you know, 25% of your program fee should you withdraw between February 14th and March 21st. And you can kind of see how it goes up from there. That's really, you know, we're not trying to make money off of students, but, you know, we, from the time that you commit to the program, we are booking flights and making payments on your behalf. Now, the cancellation policy, so kind of encompasses both the student withdrawal policy and the program cancellation policy. If the program is canceled by the host institution, a provider, or Ohio State, there will be no financial penalty for the student. If the student withdraws, you know, you will be responsible for paying the cancellation fee as it was on the previous page. At this point, if things continue to look the way they are, you know, I don't see any reason why the program would be canceled. But, you know, we found that it does happen more so than we'd like to say in recent years. So because you guys have had your flight included, really the flight is kind of the one that the students tend to get dinged on should the program be canceled. Because your flight is included in your airfare, you know, there will be no penalty for the flight if the program is canceled. Programs can be canceled at any time. You know, really before COVID, it was very, very rare that we canceled any programs, especially mid-program. But, you know, if things happen in country while you guys are there, we're constantly monitoring the situation, as are, you know, obviously our partners and the faculty on the ground. So, you know, we have canceled and brought back students if we feel that it is not a safe situation. So currently we use the Center for Disease Control and the State Department to monitor for, I don't think this is going to let me click on either, no. So for Norway specific travel, so you can go to either of those pages and kind of see, you know, what the CDC and the State Department are recommending as far as travel to those countries goes. I think it's been quite a while since some of them have been updated. So many countries are still appearing as a level 4 or 5. Previously, before COVID, you know, a level 4 or 5 country would have been a big red flag. At this point, you know, most of it is COVID related. So, you know, if parents need to discuss how we make some of these decisions, whether or not to send a program, you can direct them to me. I know there have been some concerned parents, not necessarily this group, as to how we approve or not approve a program. Like I said, right now, Norway is not requiring a quarantine or a negative COVID test to get into the country. So that could change. If it does, we will let you know. If you do need a COVID test prior to departure, that was not included in your program fee, but you should be able to get those free of charge from, you know, the pharmacy or campus. Your MRSA test, we were still clarifying whether we needed to be vaccinated, but I think all students are vaccinated, and if you aren't boosted at this point, you know, maybe that's another consideration that you need to look into. And, you know, again, it's up to you to kind of meet all those requirements. We'll do our best to pass on the information to you. You know, if you happen to be thumbing through information about Norway and you see that something looks like it's changed recently, feel free to get in touch with me, because I do my best to kind of keep my finger on the pulse, but sometimes I miss those things too. So, you know, if you catch anything that you think would be helpful to share with the group, please reach out and let me know. This kind of says, you know, A negative COVID test is required to get back into the US. So we will organize that. The group will organize that to go together and get that done. And that's included in your program fee. Should you have to quarantine for a positive test, again, it will be up to you to sort of pay for that quarantine expense. And we can talk to Uni, and I think she said they could set aside a room should we need it for a student to quarantine while on program or after the program ends. So some things, places we kind of direct students to prior to departing. The CDC is one. It's a good place to go and start planning. Norway, their health system, and their things as far as health and health considerations is pretty similar to the United States. So there's no extra vaccinations that students need to enter into Norway. We do ask students ask for students to make a travel medical consultation prior to departure. So in addition to your MRSA test, we encourage students to kind of have a meeting with their primary care physician or the student health center to kind of discuss considerations for their own healthcare while they're abroad, making sure you have your prescriptions are up to date, that you're taking enough of everything with you. I typically advise students, to plan for an extra, week or two of prescriptions, just because in the event that you're quarantined, you don't want to get stuck in Norway without a prescription that you might need to keep you healthy while you're there. Thinking about how you're going to manage conditions, any pre-existing conditions while you're abroad. Sometimes things that students have well under control here can kind of, a change in diet or time zone or the long flight can kind of, upset things that have been under control for a while. So kind of keeping an eye on how you're managing your own health, your physical and your mental health. Again, making sure you have plenty of prescriptions, kind of preparing for that well in advance. Part of your program fee, you guys will be assigned international health insurance through GeoBlue. Has anybody received the email yet? I don't think they've done this round yet. I don't think it's come out yet, but when it does, you'll actually be directed to log into the GeoBlue dashboard. When you log into the dashboard, you'll be able to enter into the city and location, the address where you'll be staying, and it will actually populate with sort of healthcare providers in the area. You'll also be able to put in any pre-existing conditions that may need treatment while you're abroad, and it will come up with a list of doctors that are, English speaking and that GeoBlue has sort of pre-assessed and pre-approved for students to visit for treatment. And then the MRSA test, which will be in touch with further information. So, essentially Norway is a fairly safe country for students to travel in. No sort of real considerations aside from, kind of looking out for your own safety. In general, we advise that students travel in groups of 2 to 3 if you do go out anywhere. Obviously, English is not the spoken language. So, things that you might pick up on here because you can speak the language and you can hear people, what people are saying, you may miss on in certain situations when you're abroad. So culturally speaking, you'll probably find that it's a little bit different. So things to kind of, that might be kind of the cultural norm here that you kind of come to expect and understand. You'll find that, you're kind of readjusting the way you think and the way that you read situations. So yeah, doing as much research as you can prior to departure is always good for students to kind of be prepared. You won't have any trouble communicating in English with, anybody that you need to communicate with. But, learning sort of the general pleasantries, hello, goodbye, where's the toilet, might be nice. I know there's apps on your phone too that you can kind of, that can kind of help you with that as well. Prior to departure, once we have booked your flight, we will send you the itinerary. And we'll also send you the hotel address, so you'll be able to register with the State Department. So essentially, you know, what this does is it kind of puts you on the State Department's radar. You know, so for instance, with the situation that's happening in Ukraine, any American citizen that's registered with the State Department has received a notification and support. It's not necessarily so they can keep tabs on you, but just so that they know, you know, in the event of something happening in country that they need to contact their citizens, that they'll be able to do that. If you've already created a portfolio or a profile, you can just go in and add this trip to it, so you don't have to create a new one. If you've created one and can't remember your login details, I don't think it hurts to create a new one anyway. So, so we just ask that you do that at some point prior to, you know, departure for the program. COVID-19 guidelines. So as far as I could tell, their masking is not something that is happening in Oslo in general. I'm assuming that with sort of your health visits and your visits to the hospital and, you know, the colleges, that you may be expected to wear masks. But just in general, kind of, you know, paying attention to, you know, the guidelines that are being suggested and recommended over there. And, you know, and exercise as much caution. If you don't know what to expect, you know, I would take a mask with you in every situation. I don't know, Jeannie or Tracy, do you have any idea, any sort of indication of what the masking requirement is going to be?
You're muted, Jeannie.
I think that they removed the mask at this point in time. But I mean, I don't really, I guess everything's kind of up in the air, I think, but I do believe they've removed their mask requirement at this point in time. So
yeah, we will send with the group some sort of general PPE supplies, but I would take your own stash as well to kind of,
yeah,
you know, making sure. And, you know, depending on your comfort level, I think that airports and airlines are still requiring masks as far as I know. So I would
the last flight I was on, and that was just, I don't know, like a couple weeks ago, we were, so.
Yeah. So you know, I would plan on that, you know, and in general, you don't want to get sick when you're over there. So, you know, even with the mask requirement gone, I would probably be inclined to wear one just to kind of cover my bases and protect myself as best as possible. So COVID testing requirements, we've already talked about this. Currently, it's not required for entry into Norway. Again, that's as of like right now, well, yesterday. So if it's changed. But yeah, so right now there's no requirements. I haven't looked at cases in Norway, but I assume that they're trending downwards like most places. So some of your other things that you want to think about packing, your CDC vaccination card. So make sure that you know where that is and that you've got that in a safe place. I would even, if you haven't done so already, recommend taking a picture of it. The same as you would with your passport, just to make sure that, you know, you have it, something if you lose it. A thermometer for daily temperature monitoring. I'm not sure if you need that, but, you know, if you want to sort of exercise an abundance of caution, I guess it wouldn't go to waste. Hand sanitizer and wipes, and then sort of your own supply of masks. If we come to find out that a certain type of mask are required, we will also let you know that, so you can be as prepared as possible. So as far as document submission, there's the post-decision items in the portal. There were some things that were due within 10 days. I think everybody got all that in, and there's some that are due kind of in the next month. So making sure that you're keeping on top of that. There's a few waivers that will have to be filled out and submitted. So make sure that, you know, you're kind of paying attention to those and reading those. If you're reading through something and it doesn't make sense, or you have questions, feel free to reach out to me. I can have virtual appointments or I can answer by email. That's no problem. I will also sort of give you a nudge if there's something you need to do and you haven't done it. So don't, sort of panic if it gets to a month and a half. We don't necessarily kick people off the program right away for that. So now, are there any questions? I know I've gone through a lot of information today, and I know sort of the more beefy in-country stuff will come later. When I've booked your flight, I will send that out, and I will also put that in the portal. Initially, we were on, one booking, but because of our smaller number, we've had to adjust the flight booking. So I don't have that with me quite yet. But yeah, you'll be departing on the 20th and then arriving on the 21st and then returning to the US on 6/4. Are there any questions, or Jeannie or Tracy, do you have anything you want to, anything more you want to share while we've got them?
If anybody has like known traveler numbers, should they give them to you, or?
Is that for the sort of entry?
For like TSA?
Yeah, you can give that to me. I'll see. We have a new travel agent, so I'm not sure how they're handling that. But yeah, if you have a TSA traveler number, you can send that through.
Like global entry or something.
Yeah,
okay.
Yeah, we can't do frequent flyer, unfortunately, because it's considered a university paid flight. But yeah, a traveler TSA number. How has that worked in the past? Did you do that last time you traveled?
Well, I don't think I had that the last time, but I do. Yeah. For like I didn't have that the last time.
Okay.
But I don't know, or maybe maybe you can go and put, maybe if somebody has that, they can go and put that in themselves.
Just
to get their
send it to me.
pass?
Send it to me for now, and I'll get it to the travel agent when we make the booking. And if they come back to me and say we can't do anything with this, then I'll let you know.
Okay.
Oh, look, the two Jeannies both have
The Jeannies have one, of course.
Did you have a question too, Jeannie?
Oh no, I was saying I have a TSA number.
Okay.
Also the global Precheck.
Yeah. I think one thing we did really want to just definitely, so we did tell you about the lab hour, so I wanted to get that out of the way. So just, we'll let you know as soon as but plan on May 11th that we will meet and just plan, all day from I think just from 8 to 5. I don't think we'll take that long. I mean, but just plan from 8 to 5. That way we've got you covered. I'm waiting to hear back from the clinical coordinator from Sarah, just to see what times and what room availability they have and where we'd be and everything like that. Flexibility is the key, yoga, think of that, because we just never know. We're guests in the country, and we're also guests to LDUC University and to all of the agencies that, they work with and everything. So I think it's good. I do think that it'll be really nice to stay at the place where we're staying this time, because they have more access to, you can control your own food. And as Jenny said, last time where we stayed was very nice, but they had a set breakfast, and the breakfast didn't come out until I think it was 7:30, and some people already had to be in clinical. So I think, you can shop on the economy, and actually that'll just be kind of better because it immerses you a little bit more in the culture as well. So, big thing. Couple things I think to bring are, think of Norway, very sustainable country. Bring a water bottle. Hardly anybody, I don't remember seeing hardly anyone, buying or carrying plastic water, water bottles that we just throw away here. So think about that, and maybe some grocery bags as well, so you can carry your food back from the grocery store, or one bag, just one. So I would think about that. The other thing that one of the rooms, and I don't know, I've never stayed here before, but one of the rooms at the old place, their blinds weren't real darkening. And so it is light at, 11, 12 o'clock at night, so I would, if you're real sensitive to that, I would actually just bring, like an eye mask or something so you can cover your head. I really would recommend that, just in case. So that was one thing. I had a little trouble sleeping, and I usually don't. And at least after the first couple nights, I'm good. But I did have some trouble, and I think just that light thing was something that got me. So, oh, we do have so okay. Don't like keep us to this schedule at all, please. But we thought you might want like a little taste. We have like a preliminary schedule, and Tracy, did you want to pull that up? And then we can also share it in the box as well, so that you can
Yes.
download it. This schedule, we have, it's very tentative. But I know that, as Jenny mentioned, we'll be leaving on Friday, arriving on Saturday. And I know a lot of you have already traveled internationally, but our whole goal is to keep you awake. And so you will see, we will do everything possible to keep you awake, just to help you acclimate a little bit quicker. So you can see we've got on the schedule, let me pull it too. Oh,
I just made you guys co-host. There you
oh,
go.
okay. Okay, good. That's perfect. Perfect.
Are you guys able to see the document now?
Yeah, thank you,
I was
Tracy.
trying to share it from Teams because when I downloaded it, it wasn't the right thing. Okay.
Oh, okay. So you can see it's a very tentative. We're still working with our, Norway to figure out where you're going to be, what you're doing for clinical and stuff like that. But previously we did home visits. We worked with the elder care. We did some of the we worked with the mental health unit as well, like home visit kind of things. So those are a lot of things we did. You also be working with some of the international students, not just from Norway, but from some of the other countries. I think we've got some students from Finland. I can't remember for Iceland, but we do have some students from, and maybe Denmark. So that is kind of a fun thing. We have a couple international things going on here as well. Not just you guys will be in country, but we do have other students that are going to be working on the COIL, the Collaborative Online International Learning, where they'll be only completing a few of their clinical hours, but they'll be completing their community project, like you guys have a community project. So we're going to have that going on. And we're also going to try to pull off again our virtual global class, where we zoom back into your peers back home with you guys being there, and have some conversations between with all the international students and your peers, just really to give everybody an international flavor and be able to compare and contrast healthcare systems and community health. So those are some things. I think it's exciting. These are the things that we've been doing for the last 3 years. You guys are going to be doing some windshield surveys, which is part of community health, like assessing the community. Everything that we do is really intentional to, get you to kind of like take a look at other countries and see things from, their perspective. So it's not just, I mean, it is a fun day too, like walking through the sculpture park, but we have, course objectives tied to everything that we're doing, and tying everything to our sustainable development goals as well. So you'll see there. Anyhow, you can take a look at it. It's very loose right now. And we do have a couple dinners that are kind of accounted for in there, but we have to take a closer look at the other thing too is we'd like to take you to one of the museums, but we just need to make sure that that's going to be open and look at like what COVID, if hopefully COVID's, will be okay. But these are all some considerations. So we'll be working with Uni and Ida and Hilda over the next, couple months to try to get this more solidified. So we will give that to you. Comfortable shoes, so if you need to go shopping and or order something, with the supply chain, you might want to order sooner rather than later. But tennis shoes are fine, or some type of comfortable shoes are really, that's great. Some of the clinical settings, a lot of them you'll actually change into your own. They supply scrubs. I always recommend that you might want to bring a set of your scrubs, your OSU scrubs, just in case. But typically what we've found is that you've worn scrubs that they've supplied in country, or you might be wearing, like on some occasions for some of the events, you're just going to wear normal clothes, khaki pants and, and a shirt. So when we're out and about in country and doing group things, we're not, yoga pants aren't okay, it's not, but just some basic pants are fine, but yoga pants are, that's just not okay. So just be aware of that. And Uni has actually told me that. So that's something we really need to keep it. But if it's like it's after hours or something and you're going to go work out, that's fine. But anyhow,
You want to talk about the blogging at all, or?
Oh, yeah. So 5798, there's one thing, Tracy and I are in the midst, well, we haven't started yet, but we'll probably replicate what we did the last time that students went with the 5798. Yeah, business casual. Business casual is fine. Definitely. And I would bring one nice outfit though, for when we do one of our final OSU dinners. I would bring one nice outfit, whatever that is. But because we did get dressed, there was one night we did get dressed up, and that was kind of fun too. So the class that Jenny will be coming to, and then Tracy and I will be leading for 5798. We will provide you more information, but it's going to be, we'll probably have you read, there's an article we're going to have you read and write a blog, and then post a sample blog, because part of what you guys are going to be doing for the class is you're going to be documenting what's happening in this class. You're going to, like everything we do, like I said, it's going to like tie to course objectives, but we're also going to have you tie it to a sustainable development goal. So we'll start off, and kind of ease you in, and everybody will do a group blog, or you'll do a group blog like together, just to kind of like how the trip is going as we're like entering into the country. And then every student will participate in 2 individual blogs. And so it's documenting the trip, tying it to the sustainable development goal, and then taking pictures and videos, and we'll be putting that on our OSU Nursing in Norway. Have some of you seen our blog from last time, the Nursing in Norway? No? So Tracy, do you think you can pull that up? Or I'll try to pull it up too. I can throw that in the chat too. But it was really nice that this trip was documented. And then the other thing is all your family members, people from your class, everybody could also see what you were doing in real time. And that was a really good experience for tying everything together for students. So I think that's the other thing you're going to be doing while you're there, is you're going to be completing your community project. And so, and you'll be working with some of the Norwegian students to complete that project together. And so that's kind of fun. But we've got some lectures for you that you also are going to listen to from the Norwegian perspective. So you'll be learning a little bit more, about their culture, they have social events, you know, that they've been great. The students there and the faculty over there have been great about planning like some social events for you guys to hook up. I may have shared this, I don't know, I may have, but we still have students that are still connected. And that was from our in-country trips, even our virtual, our COIL that we did last year. Those students are still connected. And, you know, some students actually came to my home, you know, from the Norway trip last time. Some of the Norwegian students came to my home, you know, a couple years ago, right before the pandemic hit. So there are a lot of nice connections that are made. Oh, Tracy and I, right now, so Tracy and I, we are very adamant about keeping that weekend in between the 28th and 29th. We're really adamant about trying to keep that free so that you can explore a little bit of, you know, you can explore a little bit in a safe way, you know, depending on what the requirements are and, you know, restrictions are. So we do have some time, you know, that we want you to be able to also enjoy while you're there. You just have to be back for all of our activities that are planned. That's our, because, you know, it might be considered clinical time. So
Yeah, and I would say in that, just to plan to not leave the country. That so much can happen if you get on a plane to another country, especially with the way travel is right now. So definitely see Norway, but don't go anywhere outside of Norway.
yeah, because, you know, it's hard for, I mean, yeah. So that, especially with the conditions that we're under right now, there's so much to do around, and, you know, for like a little day trip or something like that are in country. So much to be able to do. But yeah, that's definitely like our in country kind of thing right now. I don't know anything else you guys any questions?
I have a couple of questions. Are there like laundry services? Can we do laundry while we're there? I hate packing a big luggage, so I was planning on just bringing like a carry-on and having like 3 or 4 outfits, and that's it.
I believe that there are, but did we ask the, I don't know that did you guys ask this
Well,
question?
this is a different hotel too, so they might have it listed in the hotel information. You know how some hotels will have laundry service.
Right. So that's something we need.
I'm just looking now, and if I can't find it on the website, I will follow up.
Okay. I hope I can pack just a carry-on too. That's what I am. I don't know.
She won't have just a carry.
Now, mind you, remember, whatever you pack, you have got to drag with you. So it's not door-to-door service. So I'm talking to you guys, but I really should be talking right to myself on this. But
we will have to take a bus and a train. So
yeah. So once we get off the airplane, we're gonna go get our train tickets, and then we have to get our they'll take a train to the bus station, and we'll get on a bus. You know, we have to like buy our bus passes and everything like that. So, and then I don't know how close the bus is to this hotel, but I remember the last time we had to walk a little while, you know, and up hills and upstairs. I was actually pretty good, but some people had a lot of stuff. So if you have special shampoo or something, I guess that you definitely have to have, go ahead and bring it. But, you know, like some people were using those Lush bars and that aren't liquid. I mean, like people that didn't check a bag. And I have since used Lush and it has worked. But the other thing is you're not, I mean, you can go to the store and buy it too. Like if you need to buy shampoo, the other place that we were at did have like some starter shampoo that really probably lasted for a week or something. Mine lasted for like a week, or in my room, they didn't replenish it, but But you can always buy shampoo over there. Yeah, I'm sorry, Jeannie.
What amount of baggage are we allowed with our plane tickets? Like one checked bag, one carry-on?
We have not booked the ticket yet. So typically it's one bag and one carry-on. But once we book the ticket, I'll have that information for you.
Okay.
Yeah, because you guys will have to remember, the other thing is you are taking other classes. And so I know we need to be mindful of that. So you do have a little bit of time, some downtime. Since I know you'll be in psych, but you'll also be, I don't know if it's policy or leadership. I forget which class, but I know you guys have at least another class besides community and psych. I'm pretty sure, right? Don't you guys? I think so. So anyhow, so don't, make sure you bring your stuff for your other classes. Although hopefully maybe it's all online. I don't know.
Ashley, did you have more questions?
I did, yeah.
Okay.
Like I had two more. Another follow-up with like business casual. Is it acceptable to wear like an appropriate length dress? I don't know how warm it's going to be while we're there, but I have no problem wearing dress and sneakers. It's easier to find an outfit in a dress versus trying to like match things a whole bunch.
Yeah, no, I think so. I had a couple like t-shirt kind of dresses, that I wore with the little jean jacket. So I think, yeah, I think that's fine, especially for it, like if you're in the clinical setting, depending on where we're at, we'll probably do, like I said, you'll probably do scrubs. But yeah, I think like a little, like a light dress. It was hot when we were there last time. Like it was hot I did not pack, like I packed for like it being a little more like chillier, and it actually was a little bit warmer there. So I would suggest bringing like clothes that you can layer. But yeah, definitely if you can wear more than an outfit, a couple times, just like a little scarf, little jacket. So, and you know what? It doesn't really matter. It doesn't, we don't care if you wear the same 3 outfits. It's fine. We're fine.
It doesn't look like there's laundry at the site, and from the reviews, it doesn't look like there. Also, does not look like there's a laundromat in sort of close proximity. So you could do some laundry in the sink, hang it up in your bathroom.
Okay. My other question was that I appreciate the itinerary, the tentative itinerary, but like, what are the hours? I guess I know you mentioned originally or earlier that it was like some students were on different schedules, and it might be different because there's only 6 of us going. But like, what are we like buddying up with a nursing student there and like doing their clinicals, or are we doing clinicals with OSU people in Norway? Or
It was
like
both.
all of us doing
Both.
it together? Okay.
Yeah, it was both. There were sometimes you would actually meet one of the students, the Norway students at Levisenberg at the college, like right outside your hotel. And so you might meet them at 7 o'clock, and then you walked over to the site together. So there were varying times. It usually a start time was between 7 and 8 o'clock where you had to be at the site. So if that, and they don't work 10-12 hour days. I'm just telling you. So their hours are it's not going to be a 12-hour clinical. Now there are some times though where we will have a pre and post conference. We do have for sure a post conference. We've got that scheduled every day. If we need to cancel it, we will. But for the most part, we will be kind of like reporting out and debriefing every day. We want to give you some time in the evening. Sometimes you will have times where where they might have had a social event that they wanted you to attend with the international students. But I don't know that's kind of answered your question, that sometimes it's a start time around 7, but it's not going to be.
Will we also be like if that day we are going with the Norwegian nursing student, are we going, it would be like them and just one of us, or are we kind of go in like smaller groups if we did do that? Or we,
Yeah, last time we actually, it was the nursing student, the Norwegian student, and then you know, so you paired up. And there were a couple times where there might have been 3 because we had more nursing, we had more OSU students, but most of them were like pairs where you would go. And then like sometimes I would go along, you know, and ride the, you know, we would, or maybe Tracy would go along with you guys or something like that to see. We didn't go every time though. We didn't go every time, but yeah.
I have 2 questions also. One is going off of Ashley's question. So you said they're not working like 10s or 12s. Are they working like 8s?
I'd say like 6 to 8 hours.
Okay, perfect. I was like, it's not longer. That seems weird. Okay, perfect. And then as far as like our hotel situation, do we have like a roommate from the program, or is it just us, or like, are we living with everyone, or like, how does that work?
I think we have, you guys, we have a set of rooms booked. Actually, if you want to speak to that, Jenny.
Yeah, so it's shared accommodation with another student on the program. You'll have a private bathroom, your own individual bed, and the kitchenette in the room. And everybody's in the same accommodation, so you guys will all be in the same. I'm not sure as far as like proximity of rooms to each other, but you'll all be in the same, on the same site.
Cool.
And the first day we're going to go to the grocery, right, Jeannie?
Yeah,
So
that's
you
our
can get some
first.
stuff for your room.
Yeah, we'll definitely
We hope we can. We don't know.
Yeah, definitely. We'll you guys will throw your suitcases in, and you know, you're gonna want to lay down, and we're like, no, you can't. And so then we're gonna have you go to the grocery store, and that's really an experience. I mean, like seriously, like that is well, one, it is a necessity, but also it is on purpose too, just to get you acclimated really quickly. I just remember seeing students' faces like, oh my gosh, look at these raspberries. They're so cheap, you know, but look at these Pop-Tarts. They're so expensive. So.
Yeah, so you guys will all be traveling together, meeting at Columbus Airport, you know, 2 to 3 hours prior to departure as a group. And sort of navigating the flight and the airlines together. You know, once you arrive at the other end, everybody will kind of wait for each other before you get out and sort of go to the hotel. So if there's any problems in customs or immigration, there'll be sort of some support there to help you.
Mm-hmm.
I had another question.
Yeah.
While we're there, like when you said that they're like working out, is there like a gym at the hotel, or do we have access to facilities on the college? Yeah,
there's nothing in the hotel. I don't know if the university had facilities last time you went to use.
You know, I don't remember, but I do know that students said, oh my gosh, I've never walked so much before in my life. So I'm sorry, I don't know, but we can ask Uni if there's workout, like, you know, like if you're like wanting to like lift weights or something like that, that if there's, you know, if there's those, you know, that kind of equipment in the college. I think it would probably be more in the college. So laundry, and then
Like workout.
Yeah, I know that there is a laundromat though that you can go I mean, I do remember looking that up. It's just you might have to take the bus there, but you know, like that's just common. People take the bus, they walk. I mean, it's, you know, they don't. Yeah, it's expensive to have a car in the city, so.
I'll follow up on both of those. And,
Perfect.
Yeah, so you don't have to, and
thank you.
I will let you guys know the answer.
Okay.
I'm sorry, I have another question.
Don't apologize.
So I feel like the Wi-Fi is everywhere here. Is that the same in Norway, or do we have like certain spots that we can go to, or do we have to access do we have to go to the library, I guess, to access Wi-Fi, or is it kind of everywhere just like it is here?
So there is Wi-Fi at the hotel
Mhm.
and at the university. And did you guys have Wi-Fi last year or
Yeah, we did. I mean, we had it at the university, and I had it in my, we stayed on the university last time, and it was fine. Now, I will tell you, there are some sites that get blocked. There were some things that I could not access because of the European Union. I mean, I could access all of my Carmen courses, but like I couldn't access the Dayton Daily News. The tornado happened when we were there, and I couldn't access the Dayton Daily News. I couldn't access like Ohio Department of Education. I'm like, I need this for my class. But so there's a few things that the European Union may block. So I thought that was
and certainly you know, I kind of encourage students to look into their internet or their cell phone service provider, and kind of you know, if you choose to just rely on Wi-Fi while you're there and turn off all your cellular data, or if you choose to get an international calling plan, I think that T-Mobile, I think, is the one that kind of offers some free international calling to, I don't know if it's certain countries. I know with Verizon, which is who I'm with, it's about $10 a day, and you can turn it on and off. So, you know, you could rely on Wi-Fi for most of the time. You know, on your free 2 days, you know, you might want to consider turning on the cellular data and paying a little bit. Sometimes mom or dad likes to just be able to have contact with you, or, you know, significant other likes to be able to contact you, so they're willing to pay for it. But it's kind of starting to look into that now, and making sure that you're prepared, because it can get very expensive very quickly if you don't have an international calling plan.
And we did for in country, we also, and we need to actually try this out before we leave, but we all got on a group me. Is it a group? What is that?
Do we do the
GroupMe.
WhatsApp or GroupMe?
WhatsApp. I think it was
WhatsApp.
I think it was WhatsApp. I still have, yeah. So we will need to do that. And I think we probably will do that on the day that we're in the 5798 day. Yeah, I FaceTimed a lot, because I have like, so if you have an iPhone, I FaceTimed. You could Zoom. You guys all have your own Zoom account, right? Through OSU. So you can also Zoom. That works. They all Zoom in Norway. That works. So. Oh, did you have a question too, Priya?
Yeah, I had two questions. One was about like uniform, like scrubs, like they'll provide them for us, and we should bring a pair or two of our own. But do we have to have a specific kind of shoe? Like, do we have to bring our like all white or all black shoe with us to Norway?
I think I would just bring like a gym
Shoes.
tennis shoes. Yeah.
Thank you. And then my second question was the classes that we're in like over the summer that we're going to be like missing because we'll be in Norway. Are we like zooming into those when we're in Norway, or are we just like skipping class and like doing work?
So, so you're going to still have to arrange that with your professor, just to let them know, you know, that, hey, I am traveling abroad in a university for my community health clinical, not just I'm traveling abroad because I just needed a vacation, you know? So let them know, you know, that the other thing is if possible, and I know this was last time, well, I know last time, your psych instructor kind of worked with the students, and they try to arrange some of the lectures so that you wouldn't be missing so much. So maybe some of it was recorded. So they did work with us on that. But what I would do is I would reach out to your instructors, letting them know that you are going to be doing your community health clinical, and these are the dates you're going to be gone. If they could give you more information about what that would look like for you for class. Obviously, we're going to need to work around that if they're, you know, if you have to come to class, we'll need to work around that. But one thing we did do was we worked with Gina Taft last. Well, I think Gina worked with students. So if you have a class like policy or something like that, that maybe you were in the online section of it. And I think some of the classes did not meet synchronously. They were like an asynchronous. So do you guys know what that class looks like?
I think that over the summer, the three of us might be in different classes outside of community and psych because of our different tracks. But I know that my other two classes, one of them is asynchronous online and one of them is synchronous online. So, and I have a feeling that it will get recorded as well, the synchronous online.
Okay.
But community and psych, we have both of them are in person, both on Fridays for the three of us to have all of that.
Yeah. And I actually meet with Dr. Graham on Monday just to kind of talk, just to remind her that, you know, the students we do have some students traveling abroad. So, and she's the one that teaches community health. So,
Awesome.
but I would think that they would record those for you. But I'll put an email out since your guys are in all those other different classes, but I can email Dr. Graham, let her, I meet with her, but I can also let Julie Smith know, just a reminder. She knows this, but just a reminder that these are the dates you guys are going to be gone. So
Awesome. Thank you.
You're welcome.
And then one last question that I just thought of just now. As far as like plugs in the wall, is this a hotel? Like I know that sometimes when you go internationally, they'll have like American plugs. Do we have to bring a converter? Do you know if this hotel like has?
Yeah, well, I know that I did have to bring converters last time.
Cool.
And I did have a couple things blow. So
Not your computer, right?
Pardon me?
Not the computer, right?
No, thank goodness. No, but my straightener, you know, so.
Typically anything with a heating element does not like translate well. So
I never knew that. I've never had that happen before. I was like, oh, sparks.
That's not good.
Not good.
Yeah, so hair dryer, curling iron, straightener.
Yeah. We can just all pull our hair back. So
Yep, curly hair it is.
wear a hat. Other questions? I know more questions are going to come up too. So and that's totally understandable. So
yeah, you can either write them down and we can address them at the second meeting. You know, if you guys are kind of getting sort of worried in April and feel like we need to all get together again, I'd be happy to sort of have just a Q&A with everybody. As things come up, I might be sending out emails to kind of keep you updated. So, you know, kind of checking, you know, paying attention to those. Typically, sometimes it's time sensitive stuff. So just kind of being aware of that.
Thank you.
That's all that I have. I mean, if you guys don't have any more questions, I have recorded the session so that the students I will get it to the students who were not here, and also arrange to meet with them if they have questions that weren't addressed. But I think we got through a lot of information. So, and I'll post. Yeah, me too. I'll post a copy of the PowerPoints. And, you know, maybe I'll also, I don't know if I'll send out the recording to everybody, just so if you know, just want to go back and watch it because you got some free time, you can.
Yeah. And then maybe if you find out about the laundromat and then and
I'll let everybody know.
Like the workout, the workout equipment. So yeah. And then also if you do have other health conditions, I think Jenny kind of mentioned this briefly, but please, you know, not that we're trying to be nosy or anything like that, but just, you know, in case it would be something where you couldn't, you know, like answer for yourself. Sometimes it's helpful for, you know, for us to know so that we can help to advocate for you on your behalf. So
Yeah, GeoBlue also has a option to enter in any medications that you're taking, and sometimes there's restrictions on how much or what you can take into certain countries. So as soon as that card comes out, I would encourage you to register with GeoBlue to enter in all your health information on there, and they can kind of give you, some ideas of anything you need to be thinking about. And Ashley, you had a question.
Oh yeah, so I don't know if this is the right place, but I have eczema, and the Halyard brand, like across the line, like gowns, gloves, masks, like really breaks out my skin. So I'm at my last clinical site, they just didn't use Halyard at all. Every once in a while they had Halyard face masks, so I just always would have my own. But do you know like what their school or what their kind of hospital facilities, like what brand they typically use?
I do not. So that'll be another thing we need to find out, because that might be something that might need to be like provided, because like some of the places, like is it like the actual gowns, like the isolation gowns, and then the masks is what you're talking about?
Yeah, so like the surgical mask, like the regular procedure masks, the gray like nitrile gloves, and like a surgical gown. And then there was also like isolation gowns, like those yellow ones that you put your thumb through. That I had my first clinical day, I had one, and it was like within 10 minutes, I was like, oh, my hands are kind of itchy. And I looked and I'm like, oh, it's from this gown, which wasn't Halyard brand, but I am on medication, which mostly takes care of it, but there are like random things. And I've just found that it's that brand in general. And I don't know, I mean, from the gray gloves that have nitrile to like the masks that I don't think have nitrile in them. So it's just that brand, oddly enough.
Yeah. So maybe can you send us, or could you send just an email of that? And then I think maybe to me, Tracy and Jenny, and then we can follow up on that and how we would do a workaround for that. So.
And I'll try and see if I can find out what PPE because we will send some with the group that we buy from the OSU stores.
Okay.
So I will try, and it's probably not, the gowns, but masks and gloves. I'll try and find out if we can find out what brand we're purchasing. I'm not sure if that's information that we'll know at this point, but
I think it is Halyard brand because OSU, I think that's like the majority of all of our stuff.
Okay.
I work at OSU.
Okay.
That's why I know that I have to avoid all of that stuff. But I think they must have some sort of contract, because I have to get like special stuff while I'm at work.
Okay.
Yeah. So maybe you can let us know too, like what do they do in the clinical setting for you now?
I'm sorry, was that a question?
Yeah, like maybe you could just like, in the email, just include if there's accommodations that they make for you now, or
Okay.
if they, just so we can kind of like look into that.
All these new things we have to worry about.
I know. I know. And it's like these it's like real life things happen. I understand my husband has severe life-threatening allergy, and yeah. We live with it every day. So
yeah. I'm just going to send an email now and see if we know what kind of brand.
Okay. Because I wondered too, like but we can take it offline too. But yeah, just send us that information and then we can try to follow up with you. Okay. Perfect. All right. Well, keep the questions coming. We'll, just keep having information going back and forth. We find like that's just the best way. So no surprises. We'll try not to do surprises.
Yeah. Sometimes there's surprises to us too.
Yeah, so. That's right. Yeah, I'm going to retract that statement. So.
It was nice meeting with you guys. And, if you feel like you need to have a one-on-one with me, I can schedule virtual appointments too. If you just have questions, you know, I might share them answers with the group too, if I feel like it might be beneficial for everybody to hear. So don't hesitate to reach out and ask those.
All
It was
right.
nice to meet everybody.
Yeah, nice to see you guys. So
Yes, it's nice to meet you guys. And we'll let you know about the times on May 11th, right, Jeannie?
yeah, for sure.
As soon as we find out that information.
All right.
Yep. All right.
Awesome.
Everybody take
Have a
care.
good- yeah.
Bye.
Good luck. Bye-bye.
See you soon.
Bye.
Bye.